Thank you, and thank you, Omar, and thank you all for being here. And thank you to the Wisconsin Coalition to Normalize Relations with Cuba for hosting this forum about Cuba, its challenges, and its accomplishments that it offers the world. I'm thrilled to share this virtual platform with two of the most recent US graduates of Cuba's Latin America School of Medicine. It was an honor 6, 7, whatever years ago for IFCO to recommend both Dr. Olive Albanese and Dr. Alexandra Skeeter for the coveted ELAM scholarships, and wonderful to now see them as accomplished graduates. It'll be thrilling to watch them continue to grow and offer their service and their commitment to be global healthcare providers. As the world grapples with so many challenges, it's important to continue to lift up Cuba, we feel, as an example of what we might, how we might approach some of those challenges. While not perfect, Cuba does offer a model for how the world can tackle things as complex as equitable healthcare, housing, and educational opportunities, food security, things of that nature. How we might work to ensure that we attempt to bring all of us along in this journey of life in a way that allows us to share what we have, not based on race or class or gender identity. That's what Cuba offers us. I don't mean to over exaggerate Cuba's role in the world. The small island nation has certainly had to confront numerous obstacles as a former colony and as a nation that has, like all others, had to combat racism and sexism and homophobia, and all while being a country that has endured the longest blockade in history. But it should not be forgotten that just a short time ago, Cuba was revered worldwide for its brave fight to combat the Ebola crisis in Western Africa, for its willingness to send committed medical brigades to dozens of nations to curb the spread of COVID. And we all saw the plane loads of Cuban medical professionals in various countries, China, Italy, South Africa, and Suriname, and so many others, and all of them risking their lives to help fight the deadly virus. Of course, this wasn't the first time that Cuba offered itself in such a selfless way. In fact, Cuba has never wavered in her support of those who have struggled for self-determination across the globe, fighting alongside African freedom fighters. Cuban soldiers struggled feverishly to crush the racist South African army in the fight against apartheid. But not just there. Cuba's international reach stretched much further than Africa. We can never forget revolutionary Cuba's focus on exporting doctors and, in some cases, engineers to offer a critical lifeline wherever disaster struck. So, from the devastating hurricanes in Central America, Nicaragua, and Honduras, to the catastrophic earthquake in Haiti, from the horrific Chernobyl nuclear disaster in present day Ukraine, to the deadly tsunami in Indonesia, Cuba was there as she was in Mexico and Puerto Rico and Brazil, and that list just goes on and on. And of course, we can't forget the ELAM program. Thanks to the vision of Fidel Castro and the generosity of the Cuban people, tens of thousands of young people from all over the world, including the US, despite the US government's blockade, have received medical degrees, debt free, and are now offering medical services in their home countries and elsewhere across the globe. There are now 208 US graduates of ELAM. And I'm excited that we'll hear more from recent graduates, Doctors Olive and Alex, about the ELAM scholarship program that Cuba has been honored to facilitate for young people in the United States. They'll be able to tell you firsthand about their experiences in Cuba and what lies ahead for them now that they have graduated. But those of us who hunger for justice and are committed to the belief that another world is possible see the tremendous value that Cuba offers. And that's why IFCO Pastors for Peace has and will continue to organize caravans of friendship in an effort to talk about the Cuban reality and to speak out and act out against the injustice of the blockade, the brutal, relentless policy of mean-spirited sanctions that the US government has implemented for more than 6 decades. And our US-Cuba Friendshipment Caravans have always offered the people of the US the very country that has maintained a policy aimed at encouraging the Cuban people to lose faith in their government and to force other nations to isolate Cuba. They provided the opportunity to express our opposition to the US government's brutal sanctions against the Cuban people, to stand in solidarity with Cubans by donating humanitarian aid that the US government's blockade has prevented them from accessing. But it's important to note that the aid, as important as it is symbolic, because we know that the real relief Cuba needs is to have the boot of the US government off its neck by lifting the blockade once and for all, allowing Cuba to breathe and to provide its people with what it needs. And it's clear that Cuba is fully capable of doing just that. Cuba and its people are indeed resilient. Cuba is a country that is capable of providing support for other nations in time of need and has been able to galvanize its people to do the same in their own country, such as when they organized caravans of doctors to Matanzas to combat the surge of the COVID cases there. So just imagine what Cuba could do given the space and the respect that it deserves. In our earlier years, our caravans of brightly colored trucks and buses and cars would make their way through different cities across the US, bringing a message of love and friendship and calling for an end to the harsh, immoral, and illegal blockade. We'd collect tons of supplies to be donated to Cuba as a gesture of solidarity. And while we no longer travel in trucks and buses, we still caravan, albeit virtually. And we are still committed to educating about Cuba and its reality and taking action in the form of traveling to Cuba to see it for ourselves and to act as international ambassadors when we return home, to tell our family, friends, schoolmates, work colleagues, members of houses of worship, our interpretation of what Cuba is and not our government's. Today, Cuba is enduring another difficult moment. Despite his promise to reverse the stranglehold that the Trump administration put on Cuba, the Biden administration has done the exact opposite. Biden has not only refused to reverse the 243 punitive measures that the Trump administration placed on Cuba, like limiting travel, remittances, and downsizing the embassy, but he has even tightened the blockade, has maintained Cuba on the list of countries that support terrorism. And in recent visits to Cuba, I witnessed the difficulties, the long lines, the shortage of things, including medicines. But the reality is that Cuba has been subjected to a series of attacks that have created tremendous hardships for the Cuban people. In addition to the 60-plus-year-old blockade, the economic challenges, the food and medical shortages, the cause of which can be directly tied to the US government's relentless punishment of Cuba through its blockade policies. This has all been coupled with the pandemic that has struck an incredible blow to Cuba and its people. But again, despite all of these challenges, all of these attacks against her, it cannot be overstated how incredible it is that Cuba and its people have remained resilient and made tremendous accomplishments. As one example, Cuba has manufactured its own vaccines to fight COVID, 5 different vaccine candidates, and is the first country to vaccinate children as young as 2 years old. And despite the shameful efforts of opportunistic US politicians to undermine her, such as Miami Mayor Francis Suarez, who has openly called for exploring airstrikes and military intervention against the island, Cuba is trying to bounce back and is slowly doing so. Beginning November 15th, Cuba is opening up, and we are so excited to be one of the first groups to be planning to visit. From November 15th to November 26th, IFCO's 31st Friendshipment Caravan will be in Cuba. And among the things on our program will be learning about the work of Cuba to address COVID, Cuba's vaccine process, visiting 4 different scientific centers to get a better understanding of how the vaccines were produced and how they've managed to vaccinate most Cuban adults and a large number of the Cuban children. We'll learn more about Cuba's fight against COVID, including hearing from Dr. Francisco Duran, who I guess, for lack of a better way of putting it, is sort of like the, what's that guy's name? Fauci, sort of like Fauci. But the leading epidemiologist in the country and the person that Cuba's looking to for those daily reports on what's happening with COVID. We'll also have an opportunity to hear from ELAM students that participated in Pescasaje, the contact tracing program central to the fight against COVID. We'll have exchanges with young Cubans and artists and intellectuals and university students and workers, agricultural cooperative workers, to learn about producing food for the community and what it's been like to do that under these difficult times. We'll learn about the work of the CDR, it's the Committees in Defense of the Revolution, which are essentially block club associations that are keeping in touch with members of the community, especially important during these challenging times. And we'll have an exchange with President Diaz-Canel, an opportunity to ask questions and to hear about how the island is dealing with the current challenges. So it's going to be an exciting and historic caravan. We're anticipating as many as 80 caravanistas from across the country, young, old, of every race and ethnicity, first timers and veteran travelers. It'll be wonderful to be back in Cuba after such a long absence. And we will be there as Cuba's friends and neighbors, and to reiterate our commitment to stand with our friends and family and to continue to fight the unjust blockade, and to talk about our opportunity to have meetings like this with you in Milwaukee and with communities across the country who are all interested in really connecting with Cuba after this long gap. So we will go representing you and all those in the US who are determined to stand in solidarity with Cuba. And we thank you for all you do and for being here tonight to support this beautiful project, for all you've done to support Alex and Olive in their journey to become the incredible physicians that they have been trained to be. The future is bright, and together we assert that Cuba is not alone. So I thank you for being here and look forward to talking further. And I really look forward to hearing from the doctors in the house. Thank you.
Thank you, Gail. That's such a wonderful opening speech that we have. But without further ado, I have Olive Lewinsky Albanese. He's a 2009 Women and Gender Studies major from, excuse me, the University of Wisconsin. In 2013, she received a scholarship to attend La Escuela Latinoamericana de Medicina, ELAM, also known as Latin American School of Medicine in La Havana, Cuba. Graduated as a medical doctor in July of this year. She is currently working as a clinical extern managing chronic disease of Medicare patients at Sunrise Clinics, a network of federally qualified healthcare centers in rural New Mexico. She wants to specialize in family and community medicine with a focus on holistic medicine, global health, public health, healthcare for unhoused, and access to stable housing of all as essential social determinant of health. Thank you, and let's give us a round welcome to Olive Albanese.
There, do your clap. I don't know about the clap.
And then let me finish up because we have Alexandra with us too. So they're going to be speaking to us together, I guess. Alexandra was born and raised on the north side of Milwaukee. So she is one of us here from Milwaukee in that sense, and is a proud MPS graduate. After completing the International Bachelorette program from Rufus King, she went on to the University of Minnesota to get her degree in health sciences with a minor in chemistry. In July of this past year, Alexandra graduated from ELAM as well in Havana, Cuba as a medical doctor, the first in her family. She is currently studying for her next board exam and will begin to apply for a residency in the United States in family medicine with an emphasis on women's health. Let's give us a round, I guess, applause to our greatest new doctors for the United States of America. So they're going to tell us a little bit about their experiences.
Thank you for that introduction, Omar. And thank you, Gail, for your wonderful words. That caravan sounds amazing. I wish I could go, but maybe one of the next years I'll be able to. And this is Alex. Do you want to say hi, Alex?
Hi, everyone. Thanks for being here.
Dr. Alexandra Skeeter, I'm sorry. We call each other by our first name, but to the rest of you, we're doctors. And we would love to give a big shout out and a huge thank you to Gail Walker and IFCO Pastors for Peace. This organization, first of all, amongst all the other local, national, and international projects and people's movements they support, 21 years ago, they graciously took on the huge project of recruiting and recommending scholarship recipients for the amazing, incredible gift that the Cuban Ministry of Health has given and continues to give to our country and to all of our families and communities. The ELAM project, which forms Doctores de Ciencia y Conciencia, Doctors of Science and Conscience, brings students from humble backgrounds all over the world to train them to be doctors, tuition-free, with only the moral obligation to return to our communities and serve the underserved. This scholarship has changed my life completely, and without it, I never would have become a doctor. So please consider a generous donation to IFCO Pastors for Peace today so we can all contribute to keeping this important organization alive and well and thriving for generations to come.
Hi, everyone. As she said, I'm Dr. Skeeter, and I'll be sharing some of Olive's experience or as a medical student in general, what we witnessed and how we participated in the Cuban public health ministry's organized front against the pandemic as we finished our last 3 semesters of medical school. Then I'll pass it back to Olive, and she will share some of her thoughts on how ELAM gave us a conscientious education and training and some of the challenges of transitioning into the medical system in the US. So to begin, as a medical student, we, like I said, for the last 3 semesters of our medical school education, our education was complicated by COVID as the rest of the world. And so we were able to participate, and we were trained by doctors and by nurses and public health workers to properly recognize symptoms. We learned about the timeline of coronavirus and COVID-19, when to see what symptoms. We learned appropriate measures to safeguard our health, the distancing, the masking. And this is back in 2020 when we were first all finding out about COVID. And so we really appreciated all of the information and the PPE, the personal protective equipment that they supplied us with. We then got an assignment by a family doctor. So we worked hand in hand with the community doctor in Cuba, and we were able to secure the different areas that the doctor themselves visited daily. And then we did the door-to-door active screening, or what they call pesquisa in Espanol, with about 50,000 medical and other health professionals, students with local and primary care professionals. We would go, well, I guess it looked different as different levels in medical school. Our last year looked different than the year before. And so as a 5th year student, the year before we graduated, we did more of the screening because our classes were momentarily canceled for a little bit as we did the pesquisa. And then my last year, it looked different just because as a foreign student, we resumed our classes. And so we worked more in the hospital. And as an intern, we joined contact tracing protocols. We saw upfront and live patients hospitalized with COVID. We visited them at home for follow-up, ensuring patients were quarantining, keeping the general hygiene measures that were in place. Some of us volunteered in isolation centers for COVID-19 contacts. And so reflecting upon our experience, it was one, a wake-up call, realizing the integral role that we do play as students, especially in Cuba. We're really looked to as a part of the healthcare system, especially our intern year, where we are working quite a lot of hours. It is a lot of hard work. It's every day. It's seeing people. It's being in the community. It's knowing who is where and where they have been. It's emotional labor. It's assuring daily that the population, we talked a lot about COVID. We talked a lot about things, preventative measures to keep yourselves safe, the families and communities. And then it was the pandemic was our classroom for a little bit of time. Throughout the country, classes stopped, like I said, while healthcare students worked every day to help ease the burden of the healthcare system. And we bought time keeping people safe to develop the vaccine that ultimately they did develop amazingly. And then, so for the future, the students of today will become the healthcare providers and specialists of tomorrow. And so just being thankful and grateful for our education, we were able to engage with communities on such a close level. It was an excellent way to learn how the Cuban healthcare system actually functions. Students, we've been a key resource to confront the pandemic, proving that we can be counted on for the future and in future crises. And if such Cuban strategies would have been successfully implemented worldwide, it wouldn't be unfair to say that much of the devastation caused by the pandemic could have been prevented. And so with that, I will pass it back over to Olive, who has just begun her medical practice in New Mexico. So thanks, Olive.
Thank you, Dr. Skeeter. And I wanted to say that after we're finished speaking, we are going to tell everybody the eligibility requirements for applying to medical school in Cuba. So if you are thinking about it, or you know someone who is thinking about it, you can share that information. Okay, so as Omar mentioned in the intro, I'm currently working for Sunrise Clinics, a network of federally qualified health centers in rural New Mexico. A federally qualified health center, if you don't know, is a clinic that qualifies for government funding through the Public Health Service Act because they serve an underserved population. I'm currently working as a physician managing chronic care, making chronic care management monthly care calls. This is a program for people on Medicare insurance who have 2 or more chronic conditions. And while this can be very gratifying at times, it is often very challenging. And I'm going to tell you about the 2 biggest challenges I have here. So the first big challenge is that the people on my list to call are very sick. The most common conditions I see every day are diabetes, hypertension, obesity, chronic kidney disease, hyperlipidemia, heart disease, hypothyroidism, chronic pain, anxiety, depression, opioid dependence, and substance use disorders. But the list goes on. And if people have 2 chronic conditions, chances are high that they have 5 or more. I think the weight of the chronic diseases in America was something that I wasn't accustomed to, because in Cuba was such a strong emphasis on preventive medicine and primary care. You don't really see that many patients with so many comorbidities. I think that this is directly related to the fact that many poor and working class adults in the United States are uninsured or underinsured, so that by the time they get to the age where they receive America's socialist health care or Medicare at 65, they have the accumulation of a lifetime of factors such as strenuous work and the chronic stress of being poor. So all these lifestyle factors add up to cause a myriad of chronic disease. People are so sick that it can be overwhelming for the care provider. You start to think, with so much going wrong, where do I begin? So I begin by listening. I find the right questions to ask and listen to the answer, and the emotions beneath the answer. In Cuba, we were taught that 75% of all health problems can be solved with a good patient interview. But in order to give a good patient interview, you need time. So this brings me to my second major challenge here, that in our current economic system where time is money, the medical system is set up to maximize earnings. And so efficiency and speed is valued over respectful human interaction. In Cuba, where there is universal health care accessible to all people, there's never any talk of money or insurance or billing in regards to a patient care. We're taught to treat every patient with respect and dignity, and that those human-centered values are upheld at the center of healthcare. So I have a little story to emphasize my point here. Last week, I called a patient who had lung disease, hypertension, and chronic kidney disease, among other things, but he was not obese or diabetic, so his case I thought would be a little bit simpler. Looking back in his chart, I noticed that a few months prior, he had scored 4 points on a PHQ-9, a questionnaire for depression, which suggested mild depression. I reviewed his chart for all the necessary information to monitor his chronic illnesses, vital signs, renal function labs, medications, reasons for last doctor's visits, etc., before calling him to help guide my questions. When asking about his diet, I was surprised to hear him say very healthy things: yogurt, blueberries, blackberries, and that he watches his salt intake. I applauded him for taking preventive measures to control his hypertension. At the end of the call, I asked if he had any other questions or concerns for me, and he said, well, yes, there's one thing, that he was concerned about how much weight he had lost. I asked him how much weight he had lost in what time period, and he said he remembers weighing 167 pounds when he left the hospital 3 years ago. I looked at his current weight, 120 pounds. Before, when seeing his weight, I noticed that he must be thin, but his BMI was just over 20 kilograms per square meter, and it wasn't highlighted in red like the weights and BMIs are so often highlighted when people are overweight or occasionally when they are underweight. But this was such a significant new finding that I had to investigate further. I found some old documents that show that he weighed 137 pounds in 2019, which means that he must have lost 30 pounds in 1 year in 2018. I asked him what he had been in the hospital for at that time and if there had been any significant things that happened in his life in the last 3 years. So he began to share a story that he was a former alcoholic and quit last year right after Thanksgiving. He used to have a girlfriend. They would drink together to relieve anxiety. She had early onset dementia. Because of his chronic diseases, along with his overuse of alcohol, he was often very sick and would spend about a week to 10 days in the hospital every 3 months. During one of his hospital stays, a friend of his girlfriend's came to town, picked her up, and drove her to a different city 2 hours away and admitted her into a nursing home there. That was in 2018. At the same time, he moved in with his brother in a rural town even farther away. She died the following year. Since 2019, he also lost his mother and 2 aunts. I share this story to emphasize the difference between a medical system which emphasizes the patient interview as the most important part of care, and a medical system which emphasizes speed, efficiency, and 15-minute patient visits. I spent over an hour on the phone with that patient. Do you think he would have told me any of that deeply personal and emotional information about losing his loved ones if I had been in a hurry and wanted to get the call finished in 15 minutes so I could move on to the next one? No one wants to share their deepest pain unless they know that the listener is actually listening, that they care, and they have time. That's going to be the hardest part for me as I continue to transition into this medical system that demands that I constantly watch the clock and be efficient. To try to squeeze the expensive and loving values that Cuba has taught me of listening, of communicating with respect, of humane and dignified care into an inhumane and unjust system called capitalism. This will be the most difficult task. So after that downer, we promise eligibility requirements for applying to the ELAM Medical School Scholarship. First, you have to be a U.S. citizen. If you're from another country, you'll have to look into another pathway, usually through the Cuban embassy in whichever country you're in. Next, you should be under 25 years of age, and you should have passed the following pre-med courses, which all can be completed within 2 years at a local community college, which include 2 semesters of college level biology with a lab, 2 semesters of college physics with a lab, 2 semesters of inorganic chemistry with a lab, and 2 semesters of chemistry with a lab. Some introductional level Spanish is very helpful, but not required, as we have 6 months of Spanish immersion before med school begins. What else do we need, Dr. Skeeter?
Yes, I will piggyback off of you. I think some introductory level Spanish would be helpful. However, how we learned Spanish back in, well, I did 7 years ago, was very effective because I now speak Spanish. Definitely still learning every day, but they prepare you very well. And then you also would need 2 or 3 strong letters of recommendation from professors, from community leaders. I had a letter of recommendation from my college volleyball coach. And you would also need a strong background in community service, really demonstrating your commitment to serving your community when you finish. And then that goes with that, a strong desire to serve your community or your underserved community. And then some background in cross-cultural communication and social activities or local or international service projects would be helpful, would boost your application. So if anyone is interested out there, or if you know of anyone applying, please contact IFCO, or you can reach out to one of us. I don't know if you guys will drop our emails in chat, but and there's a few young women that I'm speaking to, actually one from Milwaukee that's interested in the program. And so, yeah, don't be afraid to reach out because we are here. We want to talk to you about the program and if it will be a great fit for you or anyone that you know. So thanks for letting us share.
Thank you, Omar, and thank you, Doctors Albanese and Skeeter, for your presentations. Really important information. It's important to hear directly from the graduates. Nobody can speak about this program like an ELAM grad. So I'm grateful and appreciate that. Olive, your words were piercing, but really speaks to the importance of the way that Cuba does medicine. And that's what's so wonderful about the training that ELAM students receive. So I just grateful. I was really grateful for what you had to share. And I put into the chat, you can reach out to the general IFCO email, or Samira Adri, who is also a graduate working with us until she finishes her exams. And Angie, who's on the call, is also the part of the team that we can get information about the ELAM program.
I'm just wondering if the students or if the doctors had any contact with Cuban medical students while they were at ELAM, and if they got any sense of how Cuba goes about recruiting Cubans to go to medical school. When you think about the fact that after the revolution, most of the Cuban doctors left the country and they were left with a largely illiterate population, and now they have one of the highest literacy, if not the highest literacy level in the world, and they have the highest doctor to patient ratio. of any country. They must have done some awfully good recruiting within their own nation. And I'm wondering how they encourage young people, how they get their skills up to the level where they can supply the doctors that they need for their own country when you have a relatively poor society. I think we tend to use, poverty as an excuse for not having good educational outcomes. And clearly, Cuba proves that you can have excellent educational outcomes. So I just wonder if they have any comments about that.
I'm sure I can speak. My colleague, Dr. Skeeter, had to run off to another event. But yes, we did go to school with Cuban students from third year through sixth year. So for the last 4 years of our academic training, medical, clinical training, we were integrated in the classrooms and in the wards and hospitals with Cubans. Every class in our hospital, every class was about half international students and half Cuban students. And so we became friends with many Cuban students who are now doctors as well. And I'm not sure how Cuba recruits their medical students. Actually, I know that they, at some point during middle school, and everyone takes a test to kind of decide which pathway they're going, whether they'll be going more towards university or technical school. And then many of our friends' parents were doctors, so they just followed in the family's footsteps. A few of our friends were the first one in their family to study medicine, and in those cases, they said that they always were good students in primary and middle school, and their parents and teachers and community members saw that and encouraged them at a young age. And there's certainly no shortage of exposure to medicine amongst all Cubans, so it's definitely not a far off dream or unreachable goal like it is for many American children. So that's there's one little side story. I always like to comment on this whole concept of children who want to be doctors when they grow up. And when people ask me if I wanted to be a doctor, I say I wanted to be a librarian because I spent all my time in libraries growing up. And I think becoming a doctor was never on my horizon. I could never imagine it because I didn't think it was possible, and we didn't even have health insurance growing as a child, so I never saw doctors ever, so I didn't even consider it as an option. I always thought only rich kids could be doctors. But in Cuba, it's a whole different thing with a doctor in every block. Everybody can see their doctor whenever they want. Every child could imagine that possibility, So, yes, I think I partially answered your question, but I'm not sure.
Good. Thank you. Yeah.
And can I just jump in real quickly and say, Christy, really a great book, and I just put it in the chat, is this book by Don Fitz, Cuban Healthcare, The Ongoing Revolution. And Don Fitz's daughter is a graduate of ELAM. But I just think he really lays out this really great history, and it talks a little bit about how did Cuba do it? I mean, how did they have to try for the revolution, and all these people split, but there were in the very first chapters entitled The 3,000 That Stayed. And so it's this, he tells this great story of just like how, and of course, Fidel's vision and all of it's a really good read, but I think it would be, if you're interested in knowing more, something to check out. Yeah.
Thank you. Thanks.
You're welcome. Good to see you, by the way.
You too.
I think just to add, because you mentioned poverty being a factor, Cuba has made education accessible to everyone, right? So poverty isn't really the factor, it's inaccessibility, right? Only a certain part of our population has access to medical school. So I think that's probably the major difference in allowing whoever wants to be a doctor to find a pathway and have resources to do so, even if you as a country are struggling with resources because of the blockade. So.
Thank you.
I think there were a few other questions that were missed.
This one from Peggy Haas. Is there one before that? Should I answer that one? Peggy Haas asked a question about isolation centers for COVID. And if I can elaborate a little, I can elaborate a lot because I was in one, because I had COVID in Cuba. And where I stayed was one of the isolation centers for Cubans only. I was the only extranjero. I was the only foreigner there. So they all, it was funny because they all thought I was Russian. But it was great. The food was so good. But I think the medicine for curing the virus was the food, because they gave us the portions of protein was like triple what I had in the student residence, and it was so delicious. It was great. It was in a place called, what was it called? La Aduana, and it was a school. It was like a training school where they would bring, in the past, maybe they still do before COVID, it's where they would bring groups from the provinces to come of students to come and stay there and work either in the country or training, like military training. So it was something very similar to what I was used to at the residencies, the student residency. So it was basically like a dormitory where I had my own room for the first few days, and then as I was getting better, they moved me into another room with 2 other Cuban ladies, and it was great. It was a great experience. It was so adorable on the lockers. I think I sent some of these pictures to Art Heitzer and Sandy on the text message, but I took pictures of the lockers because there was graffiti with markers inside of the lockers. All of these really sweet words about girls talking to each other, saying, "You're my best friend, I love you, I'm gonna miss you," all this. It was so sweet, and it was out in the country. It was very peaceful, and they checked on us every day, and it was very good. It was a good experience.
Coming briefly to say that question was asked by Peggy Haas. Peggy from Wisconsin, maybe Milwaukee, I'm not sure, is one of the 67 new people who will be coming on the caravan.
Mhm.
So Wisconsin has its Caravanista.
Yeah.
Awesome. Another question was, and it's related to what you might have said already, Olive. Was it possible to test enough people for COVID? Did you have sufficient test kits, and could the test kits get processed?
That's a good question. With the blockade, there's shortages of almost everything. So I'm sure, yes, there were shortages of testing kits. I know that when I was exposed in the hospital, I was exposed by a patient, a pregnant woman who turned out to be positive. We found out later, and then I was exposed and I was really worried and I wanted to get tested. I asked in the hospital, they said there wasn't enough tests for that day. They had already used their quota. And if I needed it, I would need to go to the boss of the hospital and ask and make and so that was a little sad. It was sad to see that, like, in a city in Havana, so if any of you have been there, it's a pretty densely populated city. It was disappointing to know that there weren't enough testing kits for everyone who wanted one. But then I think it also is distributed, everything is distributed in a very organized fashion and through the National Health Ministry. So when I was working in the communities during my community medicine rotation, they always had enough tests, and it was the doctor's job. That was my favorite rotation, because half of the time I was sitting in the little doctor's clinic every day, and the patients could come in anytime and talk to her. But then the other half of the day was walking around in the neighborhood and checking on people. So she mostly had a list of people who were at high risk to check on, like pregnant women with hypertension, for example. She would go and check on them every day and take their blood pressure, and other, like maybe babies who were born underweight, people like that. But then also the people who were isolated with COVID in their home. So these are people with positive COVID tests, but who were able to isolate at home. And the doctor would still go and walk to their house and check on them every day. And that was really great. So yes and no. In some areas, maybe in some parts of the city where there's a lot of big population, they might run out of tests, but the tests are very equally distributed to all of the consultorios, the primary health care. So if people go to their primary health care doctor, which is the doctor on their block, they're likely to be able to get one. If everyone rushes to the hospital at the same time, they might run out. I see another question from Art Hetzer. Where are your best friends from?
ELAM.
Well, that's a good question. Many of my best friends that I met in ELAM come from South Africa. The biggest population of students that we studied with were from South Africa and from Congo. And for me, it was easier to hang out with the South Africans because I like to speak English better than Spanish. But so yes, many of my friends were from South Africa. I also had many good friends from Chad, and some friends from Congo also. Who else? My roommate was from Argentina. And when we were at ELAM at the international school, we had a more diverse group of friends because many of them went to the provinces starting in third year. So in ELAM, we had friends from the Caribbean islands and more people from Central America and South America, and a few people from Asia. I had a roommate in ELAM from Laos, and where else? Yeah, but mostly the past 5 years, once I moved to Havana, most of my friends were from the African continent. I was one of the few non-African people that lived on the residence dorm, and I lived with thousands of other students. So it's a really great experience. Any other questions there? I'm scrolling through the messages.
I'm looking through it and I don't see anybody else unless anybody would like to just, ask directly.
I just want to say that I think that's one of the great things about ELAM is that it is so multicultural, and it's anytime you've gotten a chance to walk around ELAM, the campus, and you feel it, you see it, the whole energy. It's just so international, and I think that's one of the great gifts that students, particularly students from the U.S., get an opportunity to connect with people and make lifelong friendships, lifelong relationships. And plus, Olive, you'll be able to travel just about anywhere, and have a place to stay. It's not a bad deal,
Mm-hmm.
And then what Cuban food do you miss right now?
I was just talking to a friend, another graduate, Friday night, and she was reminding me of the pastelitos that you can buy on the street. And so I think that's it. What I miss the most, the street food, because it's something that I don't have in Wisconsin or New Mexico. Just random things. There's different kinds of little pasteles. There's the triangle kind, and then there's the round kind. The round kind, the other students call them Pop-Tarts because they have a similar consistency to Pop-Tart, but they're a little bit more cookie-like. There's other really good shortbread cookies called tortillas. There's always peanuts available in the street, salted, roasted peanuts. What else? Yeah, I miss the dining hall at my residency just because of the social atmosphere. It's hard to make very delicious food if you're cooking for thousands of people, but it was always a social event to go to lunch or dinner or breakfast. Those are some of the foods I miss.
Okay, another question came in. What was one of your best recollections and one of your most challenging experiences from your timing with ELAM?
Oh gosh. And you told me to prepare for this question and I didn't. Let me see.
I'm sure there are many of them, right?
Yes, too many. Well, I have so many memories of listening to house music with the South Africans all night outside at the at the residencia. Sometimes in Cuba, when it's so hot, it's easy to have all night parties because it's too hot during the daytime. And at nighttime, it's actually comfortable to be outside. So there was many nights just maybe falling asleep on the grass under the big moon while you listen to the music going on next to you. And I think that was one of my best memories. And we would also have bonfires too. It was kind of an American tradition. I don't know why other countries didn't start the fires very often, but I would always start the fire, or Dr. Skeeter, or because we had a fire pit back there too. It was a beautiful, beautiful big campus with cow pastures, big soccer fields, very large open space. That was one of the things I loved about it. Even though we were in the city, it felt like we were in the country because the campus was so big. There was so much space to walk around. That's what Oh, and just and sitting. Now I'm starting to remember more just thinking about it. Sitting on my desk, studying or eating dinner, looking out. I can watch like 2 or 3 different soccer games going on, a volleyball game. That was one of the best things about, I think it was a blessing for me to be in Cuba during the pandemic because when classes were canceled, and they weren't canceled, they were moved to distance learning. So we had lots of assignments and papers and self-study time, but there was no restrictions on campus, at least for being active. So the student doctors and the students were very active during the whole pandemic. Lots of football, soccer training, lots of volleyball, lots of sports that you don't really hear much of in America, like netball or rugby, or everyone was just every day playing outside. And that was a real joy to watch because I heard so many stories of sadness and loneliness and isolation from my friends up north in America that I felt so grateful and blessed to be in that environment where it was safe and we could be active and exercise and be social, because it was always required. Wearing masks is always required in the street, but it wasn't within the campus, but it was required to have it on with you wherever you go. So I would just have it hanging around my neck and then put it on if I needed it. If I was too close to people, or if we were in the dining hall, we had to put it on before we got our food. But other than that, we could walk freely in the nature, and it was wonderful. Challenging. The only challenging thing was coming home and saying goodbye. I loved it so much.
I know what the feeling is. I've been in Cuba before, and few trips that I made and taking people over there through Witness for Peace, and then such a wonderful feeling being there. It's so genuine. The people so open, so intelligent they seem, and when you talk to them, and I know that they have different ideas how to progress, how to do, but all they want is to be left alone and create their own destiny as a country by itself, like every other country in the world, and they just don't understand, leave us alone. We can do it ourselves, just lift the embargo. And it's such a profound, like you said, but that they have, that they cannot just in many ways, be who they can actually be, because they done so much with so little, and they continue, and then they show the world who they are. They're creating doctors. You're coming to us, you're saving us, you, Dr. Albanese and Alex, new generations coming to us to say this is what Cuba creates, not weapons, but doctors to help us, and it's such an inspiration. It's incredible. So
Thank you.
I guess that we can, what do you think, Gail? We can conclude our meeting for today. It looks like everybody has run out of questions. I mean, this has been one of the best, I guess, virtual meetings that I had in a long time. It's such a great thing to hear from new doctors. They're saving our communities, and keep on going, telling other people, saying, I want more people to, donate to the caravan, donate to, Wisconsin Coalition and all these causes to, keep fighting to lift the embargo. You're on mute, Gail.
I muted myself. You're right. I agree. I think it was, it felt like a little home meeting here. I mean, I get the sense that you all haven't either seen Alex or Dr. Albanese or Dr. Skeeter in a while, and just to kind of be able to check in with them just on a personal level as the community. I like to say to the students, you know, even students who are not from Milwaukee, but that there are a lot of people out there that support the students, no matter where they might be coming from, because ELAM is such a beautiful project. And so there's such great love and admiration and appreciation for people who've been able to really take this advantage of this opportunity and do, as I've said time and time again, you know, really return home with the idea of transforming healthcare here in the US, one ELAM doc at a time. And, you know, Dr. Albanese is just one of the newest, and Dr. Skeeter, one of the two of the newest doctors to be doing that. But anyway, it was wonderful to poke my head in on this homecoming in many ways for our two Milwaukee graduates. But thank you, and thank you so much for your generosity, all of you. It's incredibly inspiring. Like I said, this is really helpful for the work around ELAM. We've been expanding some of the work we've been doing. It used to be it was just about getting people into the program, but now it's also on the back end, just making sure that those who have graduated have support. So it's important work, and so your financial contributions make that possible. But of course, the caravan is the upcoming activity, and we're glad to have Peggy from representing Milwaukee. And for those of you who don't know, I was born in Milwaukee, so I always like to kind of at least come back and stick my head in and probably talk most with Art and Sandy a little bit. But it's good to see you all, and I'm really appreciative of your continuing support for not only IFCO, but for Cuba, and of course for the students and graduates of the program. And lastly, if you think of anybody who might be interested, please let us know, because this is a great opportunity, but we need help in expanding the word. So let's see if we can get a couple more Milwaukee students. That should be a project, right?
Yes, we definitely can do that. And I
Thank
pledge that I will get, you know, one more from Milwaukee for you. I know it's not going to be me, but it's going to be somebody else.
Okay. All right. Good. I'm going to hold you to it.
Yes.
Okay. Thank you, Omar.
Thank you all, and have a wonderful night. And this has been a great inspirational meeting, and we'll hope to see you again.
Yes.
Definitely.
Look forward to it.
Okay.
Dr. Albanese, thank you again.